everybody, this is another one of my blog videos, which hopefully you have seen some of the other ones. And my blogs are typically dealing with vaccine safety, the dangers of vaccines, the ingredients, things that are going on in the CDC that are affecting our children and being covered up by the CDC, and we're trying to get justice for that. I'm going to be renaming my set of blogs because I have joined in with a movement called cdcTRUTH, and I have decided to go ahead and get an Ohio chapter going. So now we are going to be having cdcTRUTH Ohio, and I'm going to make sure that I do keep everybody updated on what we're doing with that. I did have a protest scheduled for this coming Thursday, and it was going to be down in downtown Dayton, but in light of recent events with the tragedy that happened in France and the things that are going on with that, things that I've seen on the internet of possible threats in our country, I thought that it was a safer, more respectful idea to cancel the protest for right now, but it will be rescheduled. And in the meantime, I am getting things together to talk to some of our legislators and try to get things moving forward that way. My other blogs, like I said, dealt a lot with the vaccines that are required up to certain ages, and I think I briefly touched on the fact that the government is trying to make vaccines mandatory. And that's another blog that I plan on doing, is all about the Healthy People, or Healthy America, I forget how it's phrased exactly, 2020. There's a lot of stuff that's going to be implemented in 2020, and it's very scary. So I will be doing a blog on that. Today I want to focus on Baby Arrival Day, the most exciting day of anyone's life. I know it was for mine. It was something that you wait for. You spend your 9 months getting to know your baby that's inside your belly, and then it's time. It's time to meet the baby, and then it's time to care for the baby outside of the womb, which hopefully when you're pregnant, you are researching and making sure not to do some of the things that I allowed my doctor to have me do, which was get the flu shot when I was pregnant, which is very, very dangerous for your baby. I also allowed the doctor to have me on a medication. My dad had passed away when I was 5.5 months pregnant, and because of the stress levels and everything, my doctor recommended that I be put on Ambien for a month to make sure that I sleep, because it was important to get my rest. And she said it was so safe, everything was fine. I feel horrible, and I feel guilt that I didn't research that more, and I just listened to what my doctor said, because that potentially could have been a factor in the beginning of the assault that ended up causing my child to develop autism. So, Baby Arrival Day, this is something that I hope anyone who is pregnant, who plans on becoming pregnant, that you watch this video and that you listen to some of the things that you need to be aware of for when you have that beautiful, precious baby. Okay. One of the biggest things that you think about when you think about having your baby is the labor and the delivery. I will not lie, it's painful. I actually had an epidural. Once I was about 6.5 centimeters, I decided to go ahead and have an epidural because I was induced, which I wish I had not have been. And then once they break your water and do all that stuff, especially when you're induced, it becomes incredibly painful. And I mean, it's incredibly painful for anybody, but especially if you're induced, it's not a natural pain. It comes on a lot stronger, a lot faster. So, regrettably, I did do the epidural. There are other options that a lot of women take, and your doctor's not explaining to you how this can affect your child. So I'm sure you've all heard, or if you've had a child, you've heard and you've seen on movies where the women are saying, I need drugs, give me drugs. That's not safe or realistic when it comes to caring for your child, because even though you're at the end of your pregnancy, that baby is still going to get what you're getting. So when you choose to do some kind of pain medicine, usually they offer you a variety of opiates, and what that does is when you're given that medicine while you're in labor, it actually crosses the placenta and enters into the baby. So that baby is getting that medication. So some of the medications that they give you are Demerol, morphine, Stadol, fentanyl, and Nubane. Those are just some of them. And you get that medicine, and like I said, it goes past the placenta and gets into your baby's system. What that can do is when your baby is born, it can cause central nervous system depression, respiratory depression, respiratory depression, there you go, impaired early breastfeeding, which will basically is causing the baby to not be able to breastfeed correctly, which if you're trying to go the natural route with that and breastfeed, which is best for the baby if you can do it, then that's going to cause problems. It can also cause altered neurological behavior and a decreased ability to regulate body temperature. And fever is a huge issue in newborns. So, I mean, that's something that you really need to think about. The pain, it's awful, but it's temporary. The pain is temporary, but some of the things that it can do to your unborn baby is not necessarily temporary, or it's not something that is worth making your child suffer through. So that's something to think about. Sorry, I just put a paper up in front of your face. The next thing I wanted to talk about is, let me see where I was here. Oh, the clamping the cord. Okay. You've all, if you've had babies, you know that this is how it goes. You give birth. As soon as the baby comes out, they clamp that cord. They clamp the umbilical cord. And the problem with that is your baby, when you're giving birth, the baby comes out, the skull is made, the cranium is made to bend, to constrict so that it can get out of the birth canal. When it does that, sometimes, I think it's 30% of babies have a microhemorrhage in their brain from that trauma. A baby being born is not just traumatic to the mother, it's very traumatic to the baby. They're being squeezed, they're being constricted so hard that it's traumatic to their bodies. So if they have some kind of traumatic thing like that that happens to their brain, what's happening when they clamp that cord as soon as the baby comes out, that is stopping a blood flow that can come into that baby, go into the brain, and repair on its own, repair whatever damage may have been done in the brain. So, when the baby comes out and the doctor gets ready to clamp the cord, you have a right to say, I don't want the cord clamped right now. They can put the precious little baby up on your chest and leave it there for a few minutes. I honestly, I don't know exactly how long that process is. I can research that more. But it does not need to be clamped right away. On top of the fact that it's going to restrict blood flow, that baby's blood that could be going in to parts of the body that may have been damaged during, especially if it's a traumatic, more than normal traumatic birth, you know, that blood needs to be able to replenish and fix what needs to be fixed in the body. And on top of that, you're cutting off stem cells. In that blood and in that cord, there are stem cells. That's why you see a lot of people who do cord blood registry. they actually save the cord blood, because if something was to happen, some kind of disease or something in the future, that cord blood, those stem cells, can be used to heal that child, because it's their own natural, healthy stem cells. So I would personally, if I had it to do over again, I didn't know any of this when I had my son, but if I had it to do over again, I would not have let them clamp the cord right away. I would make sure that I saved up enough money, however much it was going to cost, to bank the cord blood. I mean, there's a lot of things that can come up in life, and you may need that. So just keep in mind the things that they typically do in the hospital that is not necessarily best for your baby. And it's up to you to know that. As parents, it's your responsibility to educate yourself on that and learn that, and not just rely on doctors. One of the other things that they do when the baby is first born, and I admit I did let them do this to my child because I didn't know any better, and that is putting the little goo on their eyes. I didn't even know what it was whenever they did it to my son. What it actually is erythromycin, which is an antibiotic. The reason they do this is because if a child is born, especially vaginally, if a child is born and a mother has gonorrhea or chlamydia, that bacteria can get into the eyes of the baby, and it can cause a lot of issues, potentially leading to blindness. So, I mean, that's something that's very serious. However, mothers are tested during their pregnancy to make sure that they don't have those things, just like you get the strep B test before you have your baby. If the mother does not have gonorrhea, and if there's not a high chance that the mother's partner has gonorrhea or chlamydia, this is not necessary. And the reason that I would forego this is because it's an antibiotic. Antibiotics are not good especially for newborns and infants. It can cause a lot of things. It can cause, let me see the exact words here so I'm not misquoting. Well, number one, it's not 100% effective. There's a 20% failure rate on that. And it can contribute to the development of antibiotic-resistant bacteria. And that's the problem with a lot of antibiotics. When babies, infants are given antibiotics, especially when it's, repeated thing throughout their first year of life, like my son was, it makes their immune system weak. It weakens their immune system and opens them up for even more illnesses, more diseases. And it can make the child completely resistant to that type of antibiotic. So when they get sick, what are they going to do? So the antibiotic ointment for their eyes, it can cause eye irritation or blurred vision, which can interfere with bonding. And that may seem kind of hokey, but it is incredibly important for a baby to bond with their mother and their father when they're first born. That's why they really suggest that you do the skin-to-skin contact with your child, because they need to bond. If the child's having trouble seeing, they're not going to be able to know who they're bonding with necessarily as far as sight goes. And this is something that really concerned me, especially since my son was born in 2009. Drug shortages happen occasionally, and which would mean they did not have access to the erythromycin. In 2009, there was an erythromycin shortage in the U.S., and providers began using alternative methods. And the preventative method that they typically chose to use, let me see if the name is here. I don't have the exact name here of the medication, but they started using an alternative medication on newborns that had never been tested for safety on newborns. So since they didn't have the erythromycin, they just decided this other medications should work just as good, even though it's never been tested to see if it's safe on newborns, so we're going to use it. That's absurd. That's wrong. And with them not knowing if that's going to cause harm or not, to me, that goes against their first do no harm oath. And I do have the, I don't know if I'm going to say it right, but it was called gentamicin. And that was the alternative med that they used. I apologize, I just saw it here. And what they found later is that gentamicin that they decided to use that had never been tested was causing severe reactions in newborn babies. In 2006, let me see if this is the correct thing here. Yeah, in 2006, the putting the antibiotic on the eyes became mandatory in 32 states. Some states, such as New York, don't allow parents to exercise their right to informed refusal. And in some cases, if they decided that they were not going to do that, they did not want that antibiotic, then the hospital staff would call Child Protective Services. So it's kind of hard for me to wrap my mind around sometimes. It should be our decision what we do with our children. The fact that they can call Child Protective Services because you choose to do something that you know is safer for your child is just, it's absurd to me. The vitamin K shots. This is something else that they give to children when they're first born. And I'm not sure why they decided vitamin K shots were necessary, but the vitamin K shots are used because if you are born with a shortage or a deficiency in vitamin K, it can cause certain bleeding disorders. These bleeding disorders are very rare, and it's typically when there has been a very traumatic birth. Maybe it could be needed, but children don't need to, or babies do not need to look at getting a vitamin K injection until they reach 6 months of age and their body has had time to, trying to think of the word, till the blood has done what it needs to do and gotten the nutrients it needs to see if there's even a deficiency of the vitamin K. My personal opinion would be, before they inject a child with vitamin K, that they would do testing, check the baby to see if they are deficient. Too many of the vaccines and shots are given to these babies, and we don't know what's in their immune system. We don't know what they can handle and what they can't. And vitamin K is one of those things that you don't want to give too much of. And that's not being taken into consideration. It's being given. And that's another one that's just like the eye serum. I call it gook because that's what it looks like. It's just clear, goopy stuff, and there's really no reason to do either of those. It's same as the Hep B shot. The Hep B shot is also given at day one. All this stuff is being done while you're still in the hospital. So you just gave birth. You are exhausted. I know, I've been there. You're exhausted. You're sometimes kind of panicking, like, oh, I've got this little life now I need to take care of, and I need to make the best decisions for. So when the nurses and doctors are coming in and telling you, you need to do this, you need to do that, you're obviously probably going to listen to them because you think that they know exactly what's best, and that's not always the case. The Hep B shot, Hep B is a sexually transmitted disease, first of all. The only time a baby is at risk is if the mother has Hep B, or if the father has Hep B and is going to have a lot of direct contact with the child in case, he was to get blood or some kind of fluid, bodily fluid on the baby that could infect the child. Otherwise, there's no risk. Typically, there's not a very high risk at all of Hep B. So there's no reason to give the Hep B shot at 1 day old. It's too many chemicals, it's too many toxins, and it's not safe. Just like a lot of our other vaccines, they're just not safe. And the schedule giving the shot this young goes in with the schedule recommended by the CDC, which has never been tested for safety. So we don't know how safe this is to give to our 1 day old babies. What we do know is that this being introduced, as well as a whole bunch of other vaccines, is right alongside this enormous increase in autism, ADHD, asthma, allergies, childhood diabetes, cancer, all these things that are destroying our children and our generations to come. So, my advice to you from this would be, do your research before you go into the hospital. I would be happy to answer any questions that you have about it if you want to get a hold of me on Facebook, or if you want to comment on this video, and I'll respond right away. I can do more research if you are one of those people who don't like to do research, or if you don't really know where to go to look. I have a lot of connections in the health and natural health groups, and I have a lot of people that are very knowledgeable, way more knowledgeable than me, that could help. So please do your research before you go to the hospital. Please understand that you do not have to do everything the doctors tell you to do. That is your child. That is your decision. They can try to take our rights away, but we will keep fighting to keep those rights. These are our children. We have to do what we need to protect them. And stay tuned, because I have some news coming up of some things that are going to be on some local news stations, and I will post those videos whenever that happens. And I also have some news coming up about something kind of exciting that I'm planning. So stay tuned, and I will let you guys know what we're doing. And please check out my Facebook page. It is called cdcTRUTH Ohio. And if you are in the Ohio area, please join me. Join the movement to make vaccines safer, get the truth from the CDC, and basically make it a better world. Sounds cheesy, but it's what we need to do for our kids. So I want to thank you guys all for joining me for my blog today. Sorry I was a little bit jumbled up. Got a lot on my mind, a lot of things going on. But I want to get the information out to you. So thank you for stopping in, watching my video, and please like and share so that more people can get the information they need to have before they go in and have their precious little babies. Anybody who is pregnant and having a baby, I will pray for nothing but the best for you, and good luck. God bless. You have a wonderful day. Bye.